it is about getting everybody together.
No single individual can do everything that's necessary to improve services for patients. We can only really do it if people and organisations work together, and in that way we can achieve far more.
It's really, really important that you listen to anybody before you launch anything.
We've been part of the group of people who've been trying to work together as a whole system to try and look at the shared priorities and how those things can be worked better together, making sure that the voluntary sector is considered and utilised to best effect as part of the system.
We're increasingly committed to working together in an integrated manner, really focusing services on individuals, patients and families.
Over the last 12 months there's been a series of engagements, listening to all the different groups of people about what they wanted to achieve and how we could make this even bigger and better.
What's important is to have people from lots of different backgrounds, with lots of different health conditions and situations, to really feed in a variety of views.
I just think it's great to get so many people together to talk about these kind of issues.
This plan is basically centred around prevention and what those measures can do for health in Wandsworth. And we've got three main themes here. So it's start well, it's live well, and it's age well. Start well is really important. We have issues with childhood obesity. What we want to do is to again work with parents so that we can start early on talking about healthy lifestyles and healthy eating. And mental health. As a mum, I know what the teenage years are like, and it's about support and help for identifying those issues early on.
The solution to any mental health crises or mental health problems has to include social care and mental health, but also prevention of mental health issues, understanding how these problems arise in the first place.
One of the issues that we have now is type 2 diabetes, and this is hugely important that we reach out and talk to people and have those conversations to prevent that ill health. We live in a very different society where family and friends may not be there. So it's really important that we work with the voluntary sector to actually prevent isolation, because if you're lonely, you're not going to be so healthy.
The voluntary sector, I think, is the crucial component to prevention. I think most of the key stakeholders recognise that. Keeping people well, keeping people out of hospital is not just better for them, it's key to what keeps the system flowing in the right way.
We need to improve or increase our collective work across health and care at all levels, and it not just be something we say, but that we actually implement it.
We're talking about the healthcare professionals, we're talking about the social workers in Wandsworth Council, we're talking about our much valued voluntary sector, and also we're talking about patients and their carers. So it's about listening and working together.